Hello and hi everyone. Hoping that you will be good in your life. So now come to the another most important blood test. Yes, prothrombin time international normalized ratio, which is also called in a short form PTINR test. Okay, so let's go and understand what is it, how it works, and why we need this test. And the other most important thing is the normal values for the PTINR test. So here we go. So let's discuss what is a PTINR test. Prothrombin time international normalized ratio is a blood test that measures the time it takes for your blood to clot. Actually, it helps doctor monitor the effectiveness of blood thinning medications. Okay, so the result are reported as a number called the international normalized ratio, means INR, which is a standardized measurement used to compare the result from different labs. So a normal INR is usually between 0.8 and 1.2, but the target range can vary depending on the individual's medical history and the reasons for the test. So actually why we need this PTINR test? So let's go and discuss it one by one. Okay. So the prothrombin time international normalized ratio PTINR test is needed for several reasons. First, to monitor the effectiveness of blood thinning medications. So PTINR is commonly used to monitor the effectiveness of blood thinning medications, okay, so which are often prescribed to prevent blood clots. The test measures the time it takes for blood to clot, okay, which can be affected by these medications. So the second one is to diagnose bleeding disorder. A PTINR test can be used to diagnose bleeding disorders such as hemophilia or a liver disease, which can affect the body's ability to form blood clots. And the third one, to assess the risk of bleeding, which means PTINR can be used to assess the risk of bleeding before a surgical procedure or during the treatment with blood thinning medications. Your doctor can also prescribe this test before surgical operation or any kind of operation, okay, to monitor the blood clouds, the timing of blood clouds, the timing of bleeding, okay. And the fourth one is to monitor liver functions. PTINR can also be used to monitor liver function, as the liver produces many of the proteins involved in blood clotting. So overall, the PTINR test is valuable, okay, valuable tool for the assessing blood clotting functions and managing patients who are at risk of bleeding or clotting disorder. So it can provide important information that can help doctor, okay, and you also make informed decision about treatment and management of patient's condition, of yours condition. Then what happens if high PTINR test result comes? Okay, so a high PTINR test result means that it is taking longer than normal for your blood to clot. So this can indicate that your blood is too thin, which can increase your risk of bleeding. There are several reasons your PTINR test result may be high, just like including taking a blood thinning medications. If you are taking medications such as a lot of, okay, but in here warfarin, okay, warfarin, which are designed to thin your blood and prevent blood clots, a PTINR test result may indicate that the medications is working too well. And the second one is liver disease too. The liver produces many of the protein involved in the blood clotting. So if your liver is not functioning properly, it may not produce enough of these proteins, which can lead to a high PTINR test result. Okay, so focus on this also. And as well as 3 number, vitamin K deficiency. Vitamin K is essential for blood clotting. If you are deficient in vitamin K, your blood may take a longer to clot, resulting in a high PTINR test result. Okay, And the fourth one is coagulation means there are rare and the serious condition in which the body's clotting systems start to work improperly, causing the bleeding, both bleeding and the clotting throughout the body. And then what happens if I face the low PT-INR test result? So here we go. So a low PT-INR test result means that your blood is clotting. Blood clotting is too quickly. Blood clotting is very quickly. Okay, so this can indicate that your blood is too thick, which can increase your risk of blood clots. There are several reasons why your PT-INR test result may be low. So let's discuss one by one. Vitamin K excesses. Okay, if you consume too much vitamin K in your diet or through supplements, it can increase your blood clotting ability, resulting in a low PT-INR test result. Okay, and the second one is liver disease. I mentioned earlier, the liver produces many of the proteins involved in the blood clotting. If your liver is not functioning properly, it may not produce enough of these protein, which can lead to a low PT-INR test result. Third one is certain medications or supplements. Some medications such as birth control pills or a lot of steroids can increase your blood clotting and lower PT-INR test result. So focus on these also. But before doing anything else related to this, anything you want to know about this, so consult your doctor. If you see your report, okay, so go to the doctor and consult with your doctor about your report of PT-INR test. And the fourth one is disseminated intravascular coagulation. So as mentioned earlier slide, okay, this rare and serious condition can also cause both bleeding and clotting throughout the body. So very important, this slide is for everyone. So if you have a low PT-INR test result, so your doctor will likely want to investigate the underlying cause and may adjust your medications or treatment plan accordingly. So in some cases, a low PT-INR test result may indicate a risk of blood clots. So it is important to follow your doctor's instructions. Okay, I have told you a lot of times. Doctor's instructions and continue monitoring your blood clotting ability. So it can be happened in an earlier age, in the elder of your age, or in the older of your age. So okay, monitor. The normal range I can tell according to the data what I have found, but warning I am giving you. It is important to note that the normal range for PT-INR test result can vary depending on a person's individual's medical history or the other factors. Therefore, it is important to discuss your test result with your doctor who can interpret them in the context of your overall health and medical history. So let's understand now the normal range for PT-INR test result can vary depending on the laboratory performing the test and specific assay used and the reagents they use. However, in general, a PT-INR test result of 1.0 is considered normal and indicate that the blood clotting is at normal rate. But if a person is taking blood thinning medication such as warfarin or so on, okay, warfarin, the normal range for PT-INR test result may be higher, typically between 2.0 and 3.0. This is because of medication is designed to slow down the blood clotting, man. Okay, blood clotting process to prevent the formation of blood clot. I hope you will get my positive point. Thank you very much. If you like the video, if you understand, so you must subscribe our channel for further more update.